Dr. Smart, how are you?
I'm well, thank you for asking.
Thank you for having us and thank you for the opportunity to speak with you. We understand that this is a new venture for you. You're new to El Paso and you're ready to get started. First of all, tell us a little bit about how El Paso has been for you.
El Paso's been wonderful. I moved with my family here just under 2 weeks ago. We're getting settled right in, and we've just been overwhelmed with the kindness and generosity of folks around us.
Tell us about the weather.
Well, the weather is much better here than up north. We moved from Fargo, North Dakota, and I noticed over the weekend that the temperature difference between the highest temperature here and the lowest temperature there last year was about 175 degrees, which is just almost incomprehensible.
Right, it's jaw-dropping. In regards to the surgeries you're getting ready to do, tell us a little bit about that. What's your specialization?
So I'm an oral and maxillofacial surgeon by training. I did additional training in head and neck oncology and microvascular reconstructive surgery. And that gives us the tools to treat more complex tumors of the head and neck and the oral cavity.
Is there a common denominator or a common cause for this cancer?
Some of the known risk factors for oral cavity squamous cell cancer, squamous cell carcinoma is the most common type of oral cavity cancer. Smoking and heavy alcohol use are the two most well-known risk factors. But some people can smoke and they can drink and never get a cancer, and some people, I've had a number of patients in my practice who have never smoked or never drank, and they end up with a lesion on their tongue or in the floor of their mouth, and it turns out to be a squamous cell cancer.
Is there a genetic factor to this?
There may be. The genetics of squamous cell carcinoma are complicated. We don't have clearly as an idea of the genetic predisposing factors for that as we do, for example, in breast cancer or other types of cancers. We know that there are some other types of risk factors for throat cancer, which is also a squamous cell carcinoma, similar type of cancer of the lining cells of the throat. But that can be related to human papillomavirus, or HPV, and you may have heard of this. There's a new vaccine out there called Gardasil, and that's for young people to receive that vaccination before they're even exposed to HPV.
Now, HPV is extremely common, probably more common than when any of us wish it was. Has this been something that you've noticed has been more of the cause for the cancer?
Yes, while incidence of oral cavity cancers related to smoking and heavy alcohol use have seen somewhat of a decline over the past 2 decades, HPV-related oropharyngeal or throat cancers have been increasing, especially in younger populations.
I almost believe the answer is obvious here, but can you give us some advice in regards to prevention?
You know, HPV is such a common virus. I think, there's only a few subtypes that are actually carcinogenic, or those that are known to cause cancer. And interestingly, it's a similar type of virus that can cause cervical cancer. That's the same type of thing, where the virus infects the cells and then causes them not to behave properly, and then they become cancer. The best preventive option right now, or the most definitive preventive option right now, would be the Gardasil vaccination. And that's been designed specifically against those types of subtypes of HPV.
Now, for the cancer overall, aside from the HPV-related cancer, is there any preventive actions we could take?
Yeah. So in terms of preventing oral cavity cancers or non-HPV related cancers, avoiding tobacco, specifically smoking, which is the highest risk. We know that the risk of developing oral cavity cancer is about 7 times the risk if you smoke than in a non-smoker, and 5 to 7 times the risk if you are a heavy drinker than in non-drinkers. But if you smoke and you drink, that risk is about 32-fold. So it's much higher. So there's kind of a dual action of those in the oral cavity. The other thing is, this is not as much of a preventive strategy, but a surveillance strategy, is that you should be getting an oral cavity examination every 6 months or so, especially if you're one of the at-risk population. And that can be done by your dentist. So you go in for your routine dental work and they just take a look inside. Or you can come into one of the oral surgeons here at High Desert Oral and Facial Surgery, and we're happy to take a look and do what we call an oral cancer screening exam. That's basically, it's painless. We just put some gloves on, take a look in your mouth, get a flashlight out, and make sure there aren't any suspicious lesions. Because if you do have a lesion, the best way to treat that is early. When it's an early stage is how we would term it.
Is there something that would be noticeable to the patient in regards to having it? Is something that they would notice?
Yeah. So a lot of times cancers can present as a bump on the side of the tongue or the floor of the mouth, or a sore on the gums that just won't go away, or the lip, or wherever it happens to present itself. And really anything that's around for more than about 2 weeks that isn't healing, you should probably have checked out. There are other things that can happen, other signs or symptoms that can happen along with tumors, such as a sore throat, or hoarseness. Maybe you felt like you had an upper respiratory infection or something like that, but it just won't go away. And again, about 2 weeks, if things aren't improving, then you've got a sore throat that won't go away, or pain in your ear that won't go away, or something like that. There could be something in your throat that's causing this, or something in the tongue or the base of the tongue that's causing those symptoms, and you should be evaluated.
Now, doctor, if somebody wants to come in, get checked out, where is your clinic, or what is your clinic? Where do they get a hold of you?
So we're High Desert Oral and Facial Surgery, and we have an office located on the east side over by Del Sol Medical Center. And then we have an office on the west side in the Sunland Park area. And then there's another office in Las Cruces, New Mexico as well.
Doctor, thank you very much for your time. We appreciate the opportunity to speak with you, and I hope we're able to come back and follow up with you.
Well, it's my pleasure. Thank you very much.